Welcome to Public Health Matters, where we talk about matters in public health. My name is Jane Goodman, and I'm a communications specialist with the Division of Public Health and Community Services. And I am joined here today by Bobby Bagley, the Director of Public Health, the Director of the Division. Welcome, Bobby.
Jane, thank you for having me back. It's good to see you.
It's good to see you, although I did see you about 20 minutes ago, so
yes,
in the office.
We're in a new setting,
yes.
So it's good to see you here.
Exactly. So we had to bring you back, Bobby, because we have a lot of activity going on.
We do.
In the Nashua area and in the state, not just in Nashua. So if you wouldn't mind at first, if you could just give us the COVID update.
Sure.
That is, nationwide and globally.
Right.
That'll just kind of anchor us, and then we can talk a little bit more about Nashua.
All right. Thank you, Jane. So, we have been seeing increases in COVID cases across the country and throughout the world. So this pandemic is not over. Our anticipation was that things would slow down, which we had seen over a period of time here in New Hampshire, locally in Nashua, but globally the picture wasn't changing that much. We were still seeing multiple cases erupting throughout different parts of the country. So globally, the case number is now up to 36.6 million cases, with our death toll of 1.06 million. So we're still seeing the impact of COVID as it continues to spread across the globe. In the United States, we're up to 7.6 million cases. And Jane, this is the startling thing here, that we've had over 212,000 deaths. And so for individuals, if they may not think that this disease is serious or that we don't have an issue or a crisis, we do. 212,000 individuals have lost their lives to this viral infection that is preventable. And in New Hampshire, we have had 8,878 cases. And now we're a low incidence state, right? And so that number in some other states may not seem like a lot, but for us in New Hampshire, that is a nice significant number. We've had 448 deaths thus far. In our current cases for New Hampshire, 91% have recovered. So what that lets us know is that individuals that have been impacted by COVID or infected by COVID, we do have a pretty high recovery rate, which is good. 14 current hospitalizations right now, and our hospitalization rate is still down to 9%. So that, again, those numbers don't seem as bad. Our case fatality rate is 5.7%. And again, as long as these things are low, under 6, that fares well for our state. But you still have loss of life in families where this was not planned. And it does have an impact on that family and the individuals in the family as well, and in our communities as well. Losing community members to, again, something that is preventable is hard in the community. And we're seeing the impact of that through some of the mental health issues, and I know that you've talked with folks about what we're seeing with that as well. Our positivity rate in the state of New Hampshire, so we do a percent positivity rate that's based on the number of people who were tested and what their test results come back to. So the increased number of testing that we do, and we have a certain number of positive cases. If it's a high number that we're testing, that percent positive is going to be low. So for the state, it's 1.2%. But for Nashua, we've jumped from being down at 1.1, 1.7, even I think we got down to 1.1 at one point in time, and now we're up to 3.5%.
Right, so that's tripled.
So we have seen a substantial increase in the number of cases based on our testing as well. So if we break that out by the county, in Hillsborough County, we have 4,451 cases, and again, the deaths in Hillsborough County have been 291. So we can't, when we look at these numbers, for us at the health department, this is still vigilance time. It's still time to continue to promote the information about this disease and how easily it is contracted or spread from one person to another. So now let's take a closer look at Nashua. So what do we know? What we're seeing right now is that cumulatively, all the counts all together for us from the time this event started, we're up to over 1,000 cases, so 1,044. Right now we have 99 active cases. So what that means is those active cases are individuals who were diagnosed, reported as positive, that we're still following. We're still doing work with them. Those are active cases. Our contacts is 203. So through our contact investigation, through our contact tracing, we're finding that we're having quite a few number of contacts, much higher than what we have been experiencing in the past.
So when we have cases or active cases, what people need to understand is that we work with all of those cases and we work with the contacts.
Correct.
And we have nurses and community health workers that are calling those people every day and really checking in with them to see if their symptoms are improving, to making sure they're quarantining or isolating if they have a positive test result. So this is quite a significant jump. I put these numbers in every week, Bobby, so I see.
You've seen the change.
My eyes popped wide open today when it went from like 48 to 99.
Right. You know. And we've seen this trending over the past month. And so when you do trending, you kind of look at it over a period of time. We look at the data, and the state looks at the data like over either 3 or 7 day intervals. And so when we look at this, as we look at this daily now, we're seeing these numbers go up pretty significantly. Our average number of new cases per day is now 9. Yes. And so we went from 1 to 2, probably about a little over a month ago, to now up to an average of 9. So what that means is on one day it could be 31, on another day it could be 16. It's been trending up. And so right now, I think on Monday we were averaging 8. Right. And yes, and so it's just Friday, and we're already averaging 9. So
and
could
again,
have been higher or lower.
When I go to update these weekly, I saw it was 3 last week, and now we're at 9. So we tripled.
Yes,
and that,
yeah.
One
of the things that has not changed, Jane, for us is the deaths. So there's been 38 deaths. That number has been holding steady. It's been over 2 months that we haven't seen a death in Nashua. So the state has. Not many, we were still reporting. I think we went 1 month where we probably may have had like 1 in the state, but now that number itself, it's going up. But it hasn't changed for us here in Nashua. We have a high recovery rate as well in Nashua at 91%, and we haven't had any new hospitalizations. I did hear on the news this morning that in New Hampshire, I believe I heard it was 14 hospitalizations. So that would be anybody from across the state. Exactly. And people can fact check that by going to DHHS's website to see if that number is actually 14.
Amount of information. It is. I just checked it. So it's true.
And our case fatality rate in Nashua is at 6%. So when you look at those numbers in the big scheme of things, and if you compare it to other states, you compare it to outside of New England, and you compare it to other places in the country, these numbers look really good. Okay, but when it comes to death and disease, when I say these numbers look good, that's not always good. Right. So it's like an oxymoron type thing. Right. It's not good. Look at what. Did you see what I just did?
Yes, Bobby, you broke the rules.
I just broke the rules. So
and you did it again.
Yes, I did it again because that's paper.
We're human. And that's what we have to remember.
But this is the thing that folks have to remember. So even when we do those things, so because we are human, when we do those things, the next thing that we have to remember is that I did that so that I could wash my hands, right? So I could use hand sanitizer. Because we are human, because we are going to do human things, what we have to train ourselves to do is remember that humanness, remember that, right? And wash our hands. Because that's how we keep this virus from spreading, right? So now since this is my paper and my control, that's very low risk for anyone else, except if you touch these papers, right? If I had the virus and now I hand these to you, I'm contaminating you. I've exposed you to the virus from my spit on my finger. And that's, it gets as simple as that for people to remember those simple things, right? Because it's not that complex to stop this virus. It really isn't. The things that we're asking people to do are things that are not hard, they're not complex. We're asking people to pay attention to their personal behaviors. And you see, I noticed that right away, that I licked my fingers. There's some people that they don't even realize it, they don't notice it,
it's very hard to break.
And they just keep going, exactly. And I just give you the papers, and I just put my little spittle all over it, right?
I'm not taking those papers.
You're not going to have these papers. But those are the things that, that type of observation are things that we want people to pay attention to and remind each other and be okay with saying, you just spit on that paper, I don't want that, right? And people not getting offended at that. So we do have some risk factors that, Jane, I'd like to talk about for some of these confirmed cases. And what those risk factors are is contacts to a positive case. And so on the graph, you'll see that there's 25 1% of all of our cases out of the 8,878 cases. 25.1%, their risk factor was that they came in contact with someone that was positive with COVID. Now, whether or not they knew it or the individual knew it, that's how our greatest number of contacts. When we do our investigations and we do our contact tracing and we interview people, this is what we're hearing and this is what we end up learning. 22.6%, so not far behind being in contact with a person that's diagnosed, is community transition. Now, this is a little bit harder because in community transmission, we don't know who has the virus.
Okay.
Right? Until after we find out they're confirmed. But then they may have been in the community doing things. They could have been working at a restaurant. They could have been playing in a sports league or playing in sports, and then someone ends up positive, but they don't know it because of that social or that activity that's been happening there.
So I think of that as it's in the air kind of thing.
It's in our environment, I would say. I wouldn't just say the air, I would say the environment, because Jane, I did that.
You keep doing
it. But I'm making a point.
I know.
That's the point I'm trying to make. So those behaviors that we have is what pushes this virus out into the community, and then people aren't aware of it, right? Again, I did that. I touched my paper. I put my paper down. Somebody else comes up, picks up the paper, picks it up at the very same spot where my spittle was, and then they do something like this. Okay, so this is all my own self-contamination. I did this, put it here. Somebody picks up my paper, and then they do this.
Yeah, and they touch
right
their
now,
eyes.
I've just exposed my mucous membrane to the virus that was on this finger, or I'll do another one, but I don't usually put my digit up my nose. But you know, do you understand what I'm saying?
I do.
Or
and it's a good example of community transmission of how our just regular environments and behaviors may leave the virus somewhere. And so we don't know where we're getting it, but we're touching it. We're touching our hands, our face, as you like to do like this. I don't.
Yeah, don't touch your eyes, don't touch your mouth.
Right. So, you know, we're doing that. We have to be really careful.
We have to be very careful. So community transmission occurs from those types of things. Me handling something, putting it down, somebody else picking that thing up, and then touching. It has to go from the hands to the very precious mucous membranes, eyes, nose, and mouth, right? It has to get in some kind of way there. So if we can get the virus off of our hands, if we can wash our hands and get it off, that helps. Now, the reason why I didn't say in the air is because then the respiratory droplets, right? My hands aren't necessarily touching that, but then I can inhale and breathe those droplets, right, from the air into my precious mucous membrane through my nose, right? So that's why we're asking people to wear their masks, because that's going to reduce that type of community exposure. You have your 6 feet bubble over there. I have my 6 foot bubble over here. But if we do something where I am really pushing air out further, it's going to come and impede your bubble. And then you're going to inhale it. That's community transmission. That's why we want people to have their face masks on and their coverings when they're out in the community. Cluster association is up to 31.9%.
And explain what that means.
So cluster association is where there may be 1 or 2 cases in, say, an event like we've seen with the Cyclone hockey group. That started out as something that was pretty small, then turned into a larger outbreak, right? Because then we saw that there were cases that were over here, cases that were over here, cases that were over here that were then identified to that. So it changes into, a bigger outbreak. And so when we have activities, for instance, the governor's stay-at-home has now expanded to allowing for indoor dining. And remember, we were phasing things, right?
Right.
So we had things shut down. We very slowly opened things up. We watched our numbers. We had flattened our curve. And now we're starting to open things up bigger, right? So now restaurants can have indoor seating. And that was at 50% capacity. Once that capacity goes up to 100%, you're going to be inviting more people in. This cluster associated number will go up if people don't change behaviors. Right. So if you go into a restaurant and that restaurant is packed or crowded, go someplace else.
Exactly.
Go someplace else.
Or bundle up and eat outside.
Or the thing is, and the thing that I've been saying, so I know we were throwing around the term of, new normal. I would say, you know what, you want to go out and you want to go and socialize, or you want to go out to eat and you want to go to a restaurant. I would say do all of the things that you like to do it differently. And what that differently meaning, do it in a way that protects you and others, right? International and domestic travel, we're still seeing some of that, 16.9%, because people, as things have opened up, the countries have opened up for travel, people have been going on vacations. When they come back, we're asking people to quarantine themselves for 14 days if they've gone out of the New England area, because in other places, the incidences of COVID have gone up as well. So across, as we saw our numbers, across the globe, the numbers going up. Within the United States, the numbers are going up. So if you travel outside of New England, well, now our numbers are going. We may end up on that list of don't go to New Hampshire. Let's hope that does not happen.
Let's hope that doesn't happen.
Let's hope that what we do is remember our personal behaviors, remember the mitigative measures that we should all be taking to slow this virus down, because it is in our environment, right? And then 3.5% says unclear and unknown. And it might just be because the person just cannot think of where they could have been that could have exposed them to the virus. And it could have been something as simple as this. I'm going to do it again, Jane.
You're going to lick your finger. Exactly. I was going to bring it up as an example, but, you know, it's those everyday behaviors.
It is.
That, you know, those are the things, like everyone is at risk, and people have to realize that. So you want to change that up a little bit. And we've been talking about it really for a long time, about washing your hands
Washing the hands.
And washing them for 20 seconds. I mean, how many times just shoot? No, you got to go in there and just really wash them.
Wash it off.
The motion really helps.
Yeah,
and
just
use
think
warm
of
water.
universal precautions.
Yeah.
Universal. That means all the time thinking that could have COVID on it. That could have the virus on it. Not so much thinking of, oh, that person, right? But things, right? It's in our environment. So do the things that we need to do. Wash our hands often, wash them frequently, especially when you're going out and you're in the public, going to the supermarket, going to the clothing stores, going to your hairdressers, all these places, because all these places are open now. And all these places are part of our environment, where we live, where we work, where we play, and where we pray, because we got to talk about that.
Yeah.
And you can see on this graph here, our average new COVID cases per day by week. You can see here, this slide had an average was at 7, and that was during the week of September 28th through the 4th. And now we're in the week of October 5th through, what today is the 9th?
Actually, we're at September 28th through the 4th, so we are at 9.
Right. Oh, I'm just looking at the top where it says the average there. It says
the 7-day average.
Right,
sorry,
7-day average, yeah. And so now when we get into this next week, the October 5th week through the 9th, that number is going to look very different, right?
And we're hoping it goes down, but we're not feeling too optimistic right now.
Yeah, exactly. Right?
So then the next quick chart that we'll show, and then we'll talk about some of the things that are going on in Nashua, just talks about the new cases per 100,000.
Yes.
And that really, we put this in red because that's really what put us as like a substantial increase in COVID-19 cases and put us at higher risk. The other two statistics are in blue, but as it was explained to me, all you need is one of those to go red, and you become a substantial risk.
Exactly. And so our new cases per 100,000 over 14 days, because again, we have these measures. You have the 7-day period. You have the 14-day, because the 14-day, we look at that quarantine incubation period, and if you can have 2 cycles of 14 days, then you're looking really good. Right. So this substantial, and even earlier this week, Jane, if you remember, when we first got a call about, hey, New Hampshire, you're looking substantial. Nashua, you're looking substantial. It was when it was 100.7. That was on Monday, Jane.
Yes, so things have
Today's
changed. This
Friday.
has been a crazy week at Public Health.
Yes, so we are seeing significant increase in our cases. And again, this is why we want to continue to push the messaging. Just like we did before when we flattened that curve, we had people do particular things. And you know what they were? They started increasing mask use. We're seeing now people are starting to not wear their masks. And we need people to go back to being mindful and keeping those masks on. We want people to stay at home when they're sick. Because what we're seeing, this is impacting us and our number of cases. And the thing about people being ill or sick, it's so mild. We've had a lot, and I actually really do. I'm a praying woman, and I am a very thankful woman for what our experience has been here, because other states and other towns and other places and other parts of our country have not had it as, I wouldn't say as good as we have had it here. But with the number of cases, what we're seeing is very mild disease, right? Not excluding some of the folks that have had to go to the hospital, but even that number has been pretty low in comparison to other states. We're seeing mild disease, and because we're seeing mild disease, people aren't thinking of it as COVID. So if you get a tickle in your throat, or you get a scratchy throat, or a little congestion in the morning, this time of year, nobody is thinking that that's COVID, right? Because we're going into the fall. We're going into, it's allergy season again, because now we're shifting, right? And so people aren't thinking of COVID. What we need,
well, we hope that they are, because we've been certainly pushing out a lot of words.
We need folks to start remembering that we're not out of this pandemic, and we need people to start thinking if they have those symptoms that arise, they need to start thinking about COVID. Get tested at one of the testing sites that are available on listed either under our website or on the state's website, just to rule it out. Because when you know, you can take action to stop the spread. So remember the little cluster association thing you saw there?
Right.
We can lower that down. That community association spread that we're seeing go up, we can lower that down if we can get people to retrain themselves to think, oh, I have this symptom, let me think COVID, let me rule that out.
So we're going to run out of time. So I want to.
Of course we are. You know why? Because there's so much to talk about.
There is. So let's just talk about what's going on a little bit in the Nashua area, because it has been in the news. It's no secret. It has been in the news. We had a cluster/outbreak at one of our local congregations.
So it's not a cluster any longer. It's a full.
It's a full outbreak. So we'll use the proper word. And if we just want to say a little bit about the actions, I can speak to a little bit that we are having some pop-up COVID testing clinics to make sure that if people are transmitting the virus, they know if they're positive or not. So that helps us slow the spread.
Yes.
You know, the congregants, of course, have been notified multiple times. The media has helped in many ways to get the word out so that people know if they were at services. What else are we doing, Bobby, to help mitigate this?
One of the things that we're doing, you know, that's been really helpful is we are working very closely with the pastor of the church. So this is the Gate City Church. When the pastor learned that he had a few cases, he gave us a call. So when we have a few, that's a cluster. He gave us, we were notified by the state that there was a small cluster of folks at this particular church. When he realized it, when his people who go to his church called him and told him, he sent out a message to everyone at the church to let them know that a few of their members had come back positive, stopped their services meeting in person to go in virtual. So they did that immediately. And then he also sent out a message telling folks that they should quarantine themselves. And then I contacted him once the state notified us, and we had a conversation. I asked him to send out another message, which he did, which was for folks to go and get tested, because that's the key thing. Now that you know you have 3 individuals that were positive, you want other folks to get tested so we can find out what does that actually look like at your church. And so he did, and he's been working very closely with us and very responsive. So he sent that message out. We set up a clinic. We had a clinic going on Tuesday at the Elm Street Garage, which continues every Tuesday from 3 to 5. And so members came to that testing clinic. We also were getting, because he had sent the message out earlier, people were going to testing sites, you know, throughout the southern part of our state or with their doctor's offices, and then more results started to come back. So it started to grow. So it went from cluster to outbreak once we got to a certain number. And right now we're at 16 with the folks that have gone out and have gotten tested. And so now we know that number is growing. And that number may continue to grow. And so that's why we're encouraging continual testing. We're continuing to monitor the situation, that outbreak, and we continue to work with the pastor. And as he continues to engage us, we give him updates, and then he passes the information on to his members.
Wow. So we have a lot going on in public health.
We have a lot going on.
I appreciate you taking time out of your busy day to come talk to us and talk to our community, because it's so important that people understand this information.
Right.
And I want to remind the viewers that we do have a COVID testing clinic every Tuesday at the Elm Street parking garage. It's from 3 to 5. It's a drive-through clinic. You can call our COVID hotline, 589-3456, or you can visit our website. And there's a giant button that says sign up for a COVID clinic if you go to the Division of Public Health and Community Services. And we'll be right back with our next guest.
use of face masks in public may reduce the spread of infection in the community. Everyone can help prevent the spread of respiratory droplets even when not feeling sick. Face masks or cloth coverings can be handmade or purchased. Medical face masks should be saved and used by healthcare professionals. Wearing a face mask will help protect people around you, including those at higher risk of severe illness from COVID-19 and workers who come in close contact with other people. Wear a face mask in the community when visiting indoor, crowded, or busy places. Face masks should be worn along with physical distancing, covering a cough or sneeze, washing hands, and avoiding touching your nose, mouth, and eyes with unwashed hands. Using face masks in a safe way is important. Face masks should cover your face from the top of the nose down to your chin. Clean hands with soap and water or sanitizer before and after touching your mask. Remove the mask from the ear loop. Do not touch the front of the mask. If disposable, throw away in an appropriate container. If reusable, wash often with hot water and regular detergent. Encourage others to participate and practice safe and healthy behavior. Thank you, Greater Nashua, for helping to slow the spread.
Welcome back to Public Health Matters, where we talk about matters in public health. Today we have a special guest. I always say my guests are special, but this one really is. We have Jen Swabowitz from the Nashua Division of Public Health and Community Services. Welcome.
Well, thank you so much for having me.
So Jen, tell us what you do at Public Health.
So I am the interim immunization program coordinator at this point, and I'm also doing some work with the CDC Foundation and doing contact tracing and disease investigation with this COVID-19 pandemic.
Wow, so you are very busy.
Very busy right now.
Yes.
We are all working very hard right now.
So we'll take a little break from COVID-19.
Yes.
In order to keep ourselves healthy during COVID-19. And we want to talk a lot today about immunizations.
Yes, that
and
is
vaccines,
my specialty. That is
and
what I
why
love.
And why they're important in this time, in this season, and especially during a pandemic.
Right.
So tell me what vaccines, well, we want to talk about the flu shot, but we'll come back to that. What vaccines are you currently offering right now at Nashua Public Health?
At Nashua Public Health, we are offering all vaccines. We have every childhood vaccine that is recommended and every adult vaccine that is recommended. Mm-hmm. We have everything. And we also have the flu vaccine. So that is what we are really, most busy with at this point. Mm-hmm. But at our clinics, we have been seeing lots of children catching up on their vaccines. There's definitely their school vaccines, mm-hmm. which those school nurses are really pushing the kids to get. And the adult vaccines, we do everything. We do get a good amount of people that are needing immunizations for immigration. Mm-hmm. So we can do all the immigration vaccines also. Okay. Yeah, and we do have shingles. I will say that, but there is a waiting list for that.
There is a wait list. I was lucky to get off that wait list. You kind of,
yes.
bruised me up there a little bit. But I appreciate it.
You survived.
Yes, I did just fine. I don't want to scare anyone out there. So how do you sign up for an immunization? Do you just show up, or do you have to have an appointment? I mean, these are important things for our viewers to understand.
So the Shingrix, the shingles vaccine, you definitely have to call. You definitely have to get on the wait list. Our other vaccines, no. You can just show up, and we are having, 3 to 4 clinics a week that you can just show up for, and we have everything with us.
Right.
Children, we would like to see them bring their immunization records if they do have them, or something from their doctor's office saying what they need, or if it's from immigration, what immigration needs them to have. But we will work with everybody and anybody and go through what we feel they need, and discuss it, and more than happy to do that and try to help figure out what they may need.
Right, and it's really important, especially for the children.
Yes.
Even though they're not going to school full time, that they be up to date on their immunizations.
Most definitely.
That has not gone away. School will reopen it will be back in, and they have to be up to date. And you don't want to
Yes.
put that off. You know, this is a good time to really
Most
catch
definitely.
up.
We're working closely with the school nurses at this point, and they are actually helping at some of our clinics, and they are reaching out to all the students in Nashua that may be behind or may need something and letting them know. So it's not just because we're not in school doesn't mean
Right.
you're getting away with, that you should not be getting your vaccines. Please, please stay up to date with your vaccines.
Yeah, so vaccines are very important for a multiple number
are.
of reasons, and it's also very important that if we all have them, we are more protected as
Yes,
a community.
most
so that's
definitely.
especially in a school setting. You know, you don't want a breakthrough of chickenpox, for example.
Chickenpox or measles, mumps, we see those. It's rare, but we still do see it. So yeah, it's most definite. Everyone needs their tetanus booster, especially with the pertussis. We want to protect against whooping cough because we do see whooping cough / pertussis come back around. It kind of comes in waves every few years. So we have to stay protected to protect ourselves and our loved ones in our community. It is so
Absolutely.
very important.
So let's get to the flu vaccine, because
Yes.
we are really want people, if nothing at the end of our time together, we want them to understand that you
flu.
should go and get a flu shot.
Yes.
It is so important, and it's almost doubly important during a pandemic.
This year is extremely, very important.
Yeah. So
to
can
get
you
it.
just explain why that's important? I mean, I understand, but let people understand the difference and why
So-
this year even more.
Well, on a typical year, millions of people get the flu. That turns into millions of medical appointments for flu-related illnesses. We see tens of thousands of hospitalizations every year, and we see tens of thousands of deaths every year from the flu. And this is our one big preventative measure that we have is the flu vaccine. So it is very important on a regular year to get a flu vaccine to try to help cut down on your chances of getting the flu or even spreading the flu. But this year we have the COVID-19 pandemic. And we are coming into flu season, and we're seeing COVID-19 still persist and kind of wreak havoc. So this year it is so important to be protected against the flu. As we will see, the flu and COVID can kind of have some very similar characteristics in their presentation.
And I'm just going to interrupt for a second to say that we have a little chart that we can put up.
Perfect.
That we can talk about a little bit, and about the flu and versus this chart has the common cold on it as
Right.
well, because there are a lot of similarities between the symptoms. And so I guess we want to hopefully,
Yeah.
if you've had that flu shot, maybe you can rule out flu.
Yes.
And then,
And
if
then you
do
will
come
know.
down with symptoms, to go and get a COVID test.
Right. Yes. If you look down that list, they're very similar. They cross over on almost everything. One big thing with flu that may be a difference is its abrupt onset versus COVID-19, which seems to be gradual
Okay.
from reports at this point. But they overlap. And if we know we're protected against the flu with a flu vaccine, then we can kind of lean more to knowing it's COVID-19 and you have to go get tested.
Right, of
I
course.
think our providers out there will probably test for both just to be on the safe side. But if we can protect against the flu, then we're going to cut down on hospitalizations. We're seeing an overlap. COVID-19 hospitalizations might be ramping up in the near future. We're seeing a little bit of a spike. So let's cut down on the flu visits,
Yeah.
if we can, with a flu vaccine.
Right. So I noticed on this chart that, like you said, the onset is very abrupt with flu.
Yes.
And I can say from years past that the flu kind of just hits you like a ton of bricks.
It does.
And you know that something's wrong.
Right.
Whereas what we've seen with COVID-19 is that sometimes, starts with a scratchy throat
Yep.
and the symptoms
Runny nose,
are tending to be a little bit more subtle in the
Yes.
beginning.
Yes, in
And
the
so-
beginning.
In
correct.
the beginning, and then they, catch up a bit, but it is more of a gradual onset. So that's a good tip for our viewers to understand.
Yes.
And also one thing I noticed was the shortness of breath and the respiratory issues, much more prevalent with COVID-19.
Yes, it is with COVID-19, but you do see, you know, shortness of breath with the flu, especially if you have underlying conditions, obviously asthma, respiratory issues, you're going to see the shortness of breath. It's more with the common cold that you really don't see the shortness of breath.
Right.
But with the flu, you most definitely can.
And so now we want people to understand, though, whether any symptom that you have now, we really have to go and get a COVID test.
You do. You absolutely, if you are presenting with anything, nasal congestion, runny nose, cough, headache, anything that's out of the ordinary, then your normal, say you have allergies and you every day have a runny nose or every day have a headache from your known allergies, anything out of the ordinary happens, you need to go get tested.
Right.
We need to try to keep as many people in the community safe and healthy. And in doing that, we need to know if you have COVID-19 or the flu.
Right.
And you need to quarantine yourself and isolate and stay home and help keep the community safe and healthy.
Absolutely. And so a lot of times I always think, oh, I always get a cold in the fall.
Yes.
But I know that if I get the sniffles or if I get a sore throat, I need to have a COVID test. I need to go and make sure that I'm
Yes.
not carrying this virus.
You absolutely
And so
should.
that's just another message to our viewers that, you know, this is going to be a tricky season,
Right.
because there, you know, it is cold and flu season, and now it's cold, flu, and COVID season.
Yes.
So we've got like the triple threat, and so we really want to make sure that people are doing as much as they can to protect themselves.
And with COVID-19, this push we've had to wear masks, social distance, you know, hand sanitizer, washing hands, this is all going to be very helpful for the flu too, and the common cold. I mean, we really need to be vigilant about wearing our masks out in public, about washing our hands, sanitizing, and trying to social distance.
And I think what you're saying is if we do it right, none of us will get sick this fall. You know,
Well,
wear your mask. Well, I mean, if we really
It
are
would be very
vigilant,
helpful,
wear your
yes.
mask, wash your hands, like you said, stay 6 feet apart.
Yes.
If they're not in your family, if the person's not in your family,
Right.
you know, don't get too close. You know, we'll have time
Please.
to hug again, but
Yes.
not this year.
It will come. And we just have to think about we're keeping our community healthy, we're keeping our family healthy and safe. We don't want to be bringing anything home.
Right, absolutely.
And, you know, for those that are really at risk, we need to try to be vigilant and keep our family and our community healthy.
Yes, I agree. And so we talked a little bit about the clinics. I just
Yes.
want to circle back to those.
Yes.
Do you partner with anyone for vaccine delivery?
So we do, well, we get some of our vaccine specifically from the state of New Hampshire or from specific grants that are, you know, given to the public health department so we can immunize the community. Right now with our clinics specifically, we are partnering with St. Joe's Hospital. We, on Tuesdays and Fridays, we are using their mobile outreach van, their RV, so we can immunize the community. And we also do have school nurses that are helping us out. The Nashua school nurses are helping us out to give the vaccinations.
Yeah, let's give a shout out to those school nurses.
They are amazing.
They're
They're
great.
absolutely
They work so
amazing.
hard, and even with school not fully in session, they're helping
Yeah.
there. They helped us all summer long with the
Yes.
COVID-19 testing clinics. And
Right. They're headed up by Gina, and she is fantastic, and she's the best motivator.
Yeah.
And she motivates those school nurses, and they're, you know, come on out and help us. So it's
Yeah.
been fantastic.
So is there a cost to any of these vaccines?
So yes, there is a cost for vaccines. Regular vaccines are $10.
Okay.
Flu vaccine is $15, but we will not turn anyone away for inability to pay.
Okay.
We take everybody and we'll immunize anybody.
So that's
no
good to
matter
know.
what. Yes.
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 So and those fees are very low. They really just offset the administration
Yep.
of these
It's compared.
of these
Yes.
vaccines.
Yes.
So we have a little posting that we can put up too where the immunization clinics are. You just mentioned Elm Street Middle School.
Yes.
That's twice a week, and I believe you're also at the public library.
Yes. So we're at the public library from 10 to 12 every Wednesday. We're at Elm Street Middle School in front with the RV. That is every Tuesday from 3 to 6 and every Friday from 10 to 12.
And do you have a clinic also at the Layton House?
We do the, yes, I Sorry, thank you.
That's okay. I did my
remembering
homework.
that. You did. So we do Leighton House. We're at Leighton House from 1:30 to 3:30 every other Friday. So this is the off Friday.
Okay.
So next Friday. And we are partnering with some local communities to do a closed clinic on every Monday.
Great. And just so people know, this is all on our website. So if you go to
Yes.
the City of Nashua Division of Public Health and Community Services and go specifically to community health, you can find this full schedule of immunizations.
Yes,
So
please.
this is available if you need them for your own family, or if you have a friend or neighbor in need, or you're a someone working in the community with a population in need. Please just go on the website. You know, they're very low cost, very efficient.
Yes.
I think you did like 500 flu shots last week, was it?
Oh, no, that in 2 weeks in the
2
month
weeks.
of
Okay,
September.
I lied.
But that was, I say the month of September, but we only started giving them probably midway, like the 18th.
Okay.
So within 2 weeks, we gave over 500 flu vaccines.
No, but that's great. So people are
Yeah.
coming out.
They
They're
are
turning
definitely
out. They
coming
know.
out.
Hopefully after they watch this, they'll also turn
Oh,
out and keep
Please
coming.
Please do.
We'll post about that at the end, and so that people can see that. Just one more question: what if people don't speak English? If English is a second language,
We have interpreters.
Okay.
We are community.
Of course we do. I just wanted to have you say
yes.
it.
Some of our community health workers are bilingual and fantastic, and they are here to help everyone. You know, and if need be, if there isn't a Spanish, those are Spanish speakers. But if we have others, we can always dial into the interpreter line
Okay.
and do that at the clinic. You know, and so we can help determine what you may need and help you fill out the forms.
Great. Well, so any final words? Get your flu shot.
Please
protect
go
yourself,
get your flu
protect
shot.
your family.
Yes, yes. Keep our community healthy and safe. And in doing so, you're going to keep your family healthy and safe. So please come out and see us at the clinics. We would really love to see you.
Thank you so much, Jen. And I want to remind the viewers that we do have a COVID testing clinic every Tuesday at the Elm Street parking garage. It's from 3 to 5. It's a drive-through clinic. You can call our COVID hotline, 589-3456, or you can visit our website, and there's a giant button that says sign up for a COVID clinic if you go to the Division of Public Health and Community Services. So have a great week, everybody. Stay safe, wash your hands, wear your masks, and do your part to keep our community safe.